The two things that so many women come in assuming is, one, I'm going to die, and two, my baby will be born with HIV. Number one, it's 2018. We expect you to live as long as you were intended to live, and expect you to die of whatever you were intended to die of, but it shouldn't be HIV. And two, we expect your baby to be fine. And they look at it, the first time they hear it, they look at us like we're crazy.
We have patients still today who, well, you know, my sister said I can come and live at the house, but I can't interact with my niece and my nephew because they might catch it from me.
One person said, one day we had something in the kitchen and the person said, did Sister Watson cook anything in there? Not knowing that Sister Watson and Sister Hill standing there with the same person you're talking about. And it's in the church. So trust me, it happens there.
I wish I could just shout it out to the world that they need to get educated. I mean, get educated, because there's some patients that come with people and they say, well, when should I start buying their paper plates? When should I start buying their covers? And I said, why? And he said, because they're HIV. I said, what? They're HIV. I said, oh, so you want to separate them? Would you like to separate them? Would you like your child to separate you and sit you over there? I said, don't. They need all your love and all your attention, and to live a normal life. Live a normal life. I'm living it. But you will know. I said, oh, I forgot to tell you, I'm a patient here too.
Thomas Street opened its doors in 1989 as a freestanding HIV clinic. We think it was the first freestanding HIV clinic in the country. Thomas Street is one of the largest HIV clinics in the entire United States. No one else has the kind of cumulative experience with HIV care, especially the complex, really sick patients that Thomas Street has. We also provide very multidisciplinary care. So under one roof, you not only get care for your HIV infection, but also we're the primary care provider for the patients. We also have a diabetes specialist who can deal with those complications. We have a person who specializes in the cancers that are associated with HIV here at Thomas Street. We have psychiatry here. We have OB/GYN services here. We have a rheumatologist here. So we try to bring everything under one roof, including pharmacy and lab and all the physical therapy and all the things that a person might need to really take care of themselves well.
April the 24th, 2003, I went to the emergency room. And when I entered, the doctor said, due to the signs and symptoms, and you being an African American, there's an important test I like to take. So then he just come out and said, you have full-blown AIDS. But at that moment, I went into total shock. In the middle of the night, you coming through and you don't know, and all I can vaguely see is people walking around crying. Where at that point, my sister was telling me, and the doctors have said, we've done all we can do. She may not make it through the night. Just call out the family and say their goodbyes. Well, I made it, and I'm here 15 years later.
The treatments are amazing from when I first started in this and people were on 25 to 30 pills a day. The treatments were making them more sick than the virus.
I started out with like 29 different medications, this, that, and that, and blood pressure out of everything just going crazy. And now, thankful that I'm down to 2 a day.
So once patients have been on medications, nowadays with the new medications, maybe after an approximately of 2 months, the viral load, the amount of HIV in the blood will become suppressed and they'll become undetectable. And at that time, the chance of transmitting the virus are extremely low, if not none.
10 years ago, CDC realized that people weren't being tested for HIV with enough regularity. And there were large parts of the population that had never been tested for HIV. And that's clearly, that makes no sense, right? This is a treatable infection, that the earlier you start treatment, the better off you're going to be. And actually, if you treat people with HIV, you can reduce their risk of giving HIV to someone else, even without condom use, to essentially zero. So CDC released guidelines saying basically test everyone for HIV in any healthcare setting, period. So in response to that recommendation in 2006, we established Project RUSH. RUSH stands for Routine Universal Screening for HIV, and it's Harris Health wide now. And so anyone who comes in to a Harris Health facility should get an HIV test.
And the CDC is in love with Harris Health because the program has been very successful in 10 years, and we're well on to 1 million tests now, which is unheard of in the HIV prevention field. And I know that we found more than 5,000 new positives. So these are people who were diagnosed in one of our facilities and would never have known if that project had not been in place.
Thomas Street is available to anyone living with HIV and AIDS. Harris Health takes all payers, insurance, not insured if you're not insured. There are multiple programs after our patients go through an eligibility assessment to ensure that anyone that is in need of care gets it, because HIV and AIDS is not just Thomas Street. It's community-wide, it's population-wide, it's worldwide. So when we do the little bit that we can, it impacts a community, impacts a country, impacts a nation.
I keep a smile on my face, and a lot of people ask me, how do you keep smiling, dealing with this? I refuse to walk around with a frown on my face, because I'm breathing, I'm still walking, and I'm still living.
The main thing here that I like is I'm actually the smile. That makes my whole world, the smile, a lot, because if you're not in our shoes, then you don't know what's going on. Just what you read of books and that, no, you have to be in my shoes to understand that word, HIV. And it's not a death sentence. No, we got a life sentence to go on. Thank you.